I think that the focus of what is considered the best surgical care evolved over the years. And now we know that having the best possible tools is very important, but it's not the only important thing that is needed.
How can we ride on the coattails of all this innovation? It's really taking that technology and looking at everybody else who can benefit from that.
We should look at what is the socioeconomic determinant around each patient that is bringing that patient into the hospital. By understanding that particular patient that comes to the hospital, we might be able to prevent a whole bunch of other patients that are in the same neighborhood from coming into the hospital in the future.
My name is Dr. Umut Sarpel. I'm a surgical oncologist here at Mount Sinai. I take care of patients who have cancer, mostly in the abdomen. I also do research on social determinants of health, and I also teach.
My name is Isabel Germano. I'm a professor of neurosurgery, neurology, and oncological sciences at the Icahn School of Medicine. I am also the director of the Comprehensive Brain Tumor Program at Mount Sinai and the co-director of the Stereotactic Radiosurgery Program. I serve as the Vice Chair for Diversity and Inclusion within the Department of Neurosurgery. Not necessarily everything we do is done inside of the operating room. There are things that are as important to take good care of our patients and to advance the field that are revolving around the operating room. Our future is to leverage our technology to understand how can we make that surgery better, not just because we use a better knife or a better microscope, but because the digital technology allows us to investigate such that that operation is successful.
The theme for social determinants of health is to get past pointing out that there are disparities and finding something that's actionable to actually try to undo barriers. The greatest impact on humanity is going to be in applying that to overcoming these social determinants of health.
Can I really have an impact as a surgeon on the other spheres beside the healthcare? And the answer is yes.
Students today have a completely different understanding of what rights people should have in terms of access to technology and, by virtue of that, access to surgical care.
We are riding a wave where the technology is exploding.
This is such an exciting time.
The number of products that we can develop around this concept is unlimited.